Hi YouTube! So I'm just finishing up my second week of neurology, so I'm halfway done, which is crazy. Everything seems to go so super fast. So I think my last video I finished my very first day, and it's been pretty much similar. I'm just doing outpatient neurology clinic, and my physician works Monday, Tuesday, half Wednesday, Thursday is like kind of a half day because we see patients in the morning, and then the second half day is sometimes procedures or administration work, and then she has Fridays off. But I joke that Fridays are my orphan days, and I kind of just there's another neurologist that I was with today, so I'll explain that. But it's been going well. It's very, very different from ER. Obviously, it's clinic, and we see patients either in a half-hour block or an hour-long block. And I guess when patients go see their neurologist, they pretty much want to see their neurologist and not the medical student. Whereas in the ED, I guess it didn't really matter who they told what was going on because they just needed to tell someone and needed to get fixed. So it's very different in that aspect because I pretty much just sit and listen, and most of it, like 90% of the time spent with the patient, is just updating because she's seen pretty much all these patients before, and it's just updating on new information, how things are going, anything progressing, how is this medication working, any side effects. So a lot of time is just spent in history, and then we usually do just like a focused neuro exam on most patients. Our new patients, we obviously have an hour time slot, and we do a more comprehensive neuro exam. And then depending on what their symptoms are, obviously do that. But so I just kind of sit there for the history / catching up session. But she always gives me a chance to ask any questions. And then I usually get to do the neuro exam. So I have, I think, really come a long way in my neuro exam, and just being able to, off the top of my head, do all of it and focus in maybe on if someone has like a peripheral neuropathy, really focus in on that. So yeah, it's just been interesting, and it's weird having like normal hours. Like we usually see patients pretty much 8 to noon, and then have an hour lunch, and then some days we see patients from like 1 to 2:30 or 3, and she dictates, and I sit and I listen, which is interesting because I'm used to writing up my own notes in the ED, and this time around she dictates. But it's helpful to sit and listen because I'm starting to get an idea of what she finds important, and I really like how she's. And I can see myself in the future taking notes like her. She really writes a lot, and then as she dictates, she crosses things off, and so that's really cool. But she gave me a 3-ring binder of stuff to look through, and a lot of it's like, I don't know, I have the Blueprints Neurology book, and that's just basic. I mean, that will get you the basics done. But things that she wants me to look up are things like, oh, well, what's a new, we've exhausted all these treatments for painful peripheral neuropathy. Like, what's a new option? Oh, he's maxed out on gabapentin. What about pregabalin? What about the rotigotine patch I think I looked up on? And so she really likes, obviously, evidence-based medicine and looking up studies, and she's super, super smart, and like she has an extra degree in like headaches and stuff. So not extra degree, but fellowship, I don't know, but she knows a lot. Like I was reading papers on the greater occipital nerve block, and she just has all these like research papers, and so it's just very different because my ED rotation, it was the big Tintinelli's textbook, and I would just go to that and read the synopsis. Oh, okay, these are the signs and symptoms, the physical exam, and this, and this is kind of and sometimes it'd be like a flow chart of this is what you need to do. This is just so different, which is good. I guess this is why we all do different rotations and get a little different aspect of everything. And but I'd say like I don't have nearly as much freedom as I did in my last rotation. I did see a patient, I think I've seen 2 now on my own, where I go in the room, and sometimes we were busy that day, and so she'd let me go get the patient and go into a different room and do a history. Usually it's new patients because they're not going to be like, oh, well, how come I can't see my doctor right away? Because obviously I go back in with her, but I could do a history, kind of work through everything, and it's usually all a mess. There's no like easy little, oh, usually people are on 5 to 40 medications and they're seeing all these different doctors and you're trying to figure out, and some patients have no idea what, oh, so, you're trying to go through their med list, and oh my goodness, it takes a while. And I think I spent 90 minutes with a patient. It's crazy. And then, do the physical exam, which is mostly neuro. Oh, I actually got to do some mental exams, which was really interesting and sad at the same time. And one patient I couldn't stop thinking about over the weekend, just on how well he did on his mental status. Like, we had to draw the clock face and everything, and he used to have quite the job beforehand, but due to dementia, he was definitely, like, he couldn't draw the clock face, and so that just made me, it was just sad to see, and also how much it affects your significant other, and maybe the children. His wife was there with him, and it was just hard, asking all the memory questions, and his wife obviously was distressed when he couldn't answer some of the easy ones, or what we would consider easy. And so doing the mental exam or the mini mental, or the slums, I did a few of those, is harder than I think, because the ones I've done on people have scored anywhere from 5 to 20, and I'm used to people maybe getting 1 or 2 points off. So yeah, but I find that's a fascinating and sad at the same time. So that's hard. Anyways, I'm just babbling on, but let's see. Today I wanted to do this video because I had an amazing day, actually half day, because it is now just past lunchtime. And so Friday she is off, so I was with a different neurologist, but she's kind of changing positions and helping out a lot with palliative care and that. So I followed her around today, and we did a few palliative care meetings, and then I went to an IDT meeting, which is interdisciplinary team meeting. And so they're kind of like at a transitional care hospital. I don't know exactly how to describe it, but they all met. There was, I actually had my notes with me, usually 1 or 2 social workers, nurse, the provider, nutritionalist, recreational therapist, I know there's more, me and the medical director and all that stuff. And they all sat at the table, and they go patient by patient and discuss them. And then every 90 days or something, they're called quarterlies, they need to involve the family or the patient, obviously, on deciding and goals of care. And I don't know why, but I absolutely loved that. I love seeing that teamwork and everyone figuring out, like, we sat down with the family and had to make some decision, or they had to help the team make decisions what was best for the patient due to dementia, and what would he want, what kind of care measures do we, it was fascinating. And I find that I just really like that palliative care, hospice care. I love that. So I know that's an option in the future for me as a family physician, maybe overseeing a nursing home, or even just patients who aren't necessarily in the nursing home, having those kinds of conversations and bringing in social workers and nurses and providers, and just, I don't know why, but that just, energized me today. And I should have said this in the beginning, but I hope, I don't think I sound normal, so you guys probably don't think I sound normal, but I am fighting a cold. At least that's what I finally have figured it to be. Last week, I'd say like last Sunday, was it? Maybe even Saturday night, I just started having like difficulty breathing, which I know sounds weird, but it's like I almost had to sit up at night, and I think this is what it ended up being. Like, my vocal cords just felt like those were super swollen, and sure enough, Sunday I woke up and I was like, I can't. I like could not talk. It's like some type of laryngitis. And allergies are really bad here right now. And I usually don't have allergies, but sometimes later in life, my dad is allergic, has really bad allergies to ragweeds, and that's what's around here right now. So I was thinking, oh, maybe I have allergies because I definitely was having the postnasal drip. I thought it was affecting my vocal cords, and that had swelled up just due to irritation. And so it was crazy because then on Monday I still sounded horrible, but I felt fine. I didn't feel sick at all. As Monday progressed, I ended up getting just super congested. Tuesday, I had a bunch of sinus pain and just super congested again. And I had this cough. And anyway, so I just kept blaming it on allergies. But I think by now it is not allergies. And I think it has turned into a cold. But I didn't have the sore throat. And it's not my typical cold. So I was a little bit leery. Anyways, so yeah, I feel like every rotation I just get one illness. So yay. I had strep throat last rotation, and now I have this cold, so I should be good to go now for the next 2 weeks, right? And I got my flu shot, so I will not be hopefully getting the flu, or at least those 3 strains of flu this year. Let's see. So anyways, that was off topic. I don't know, I really like that palliative care aspect, and loved it. Another thing I'm noticing is, since I already kind of know what I want to do, it's not really very, like, but it's easier for the physicians if the med student's like, oh, I don't really know what I want to do, and it's like, they ask me, I'm going to be honest, and I say, I want to do family medicine in a small town, and I want it to be full spectrum care, and I kind of spin it like any specialty I see is going to be super informative, because I just want to learn as much from them, because I'm going to be seeing a little bit of that as well. And then also what I always ask them too is, me going into primary care, how can I be of help to my future neurologist references and all that for my patients. And I don't know. And I know I love primary care because we had a patient, we were talking about sleep hygiene and all that, and afterwards I was like, oh my gosh, that was super exciting. I'm so glad you talked to him about that, and I'd love to, talk to patients about that. She's like, yep, that's definitely primary care. And so I'm noticing that even though I made a decision early on, I'm still finding things that excite me are usually the primary care type of things. I don't know. Let's see. Last weekend, John came and hung out because it was Labor Day weekend. His parents came and sister. So that was really fun. We went to the farmer's market and just hung out and kind of walked around the different shops, and that was really fun. I love seeing family, and I love having weekends. Another big change from first and second year is I felt like we had at least one test a week, sometimes 3 or 4. So weekends weren't really weekends. You sometimes would have a good weekend, but you always were studying. But depending on your rotation, what rotation it is, how much you're expected to be doing, and if you keep up on your readings throughout the week, you actually might have a really nice weekend. So I was able Friday hang out with them, Saturday hang out. John came and we hung out that weekend. He left Sunday and we had Monday off for Labor Day. So I just helped prepare meals. I went to the grocery store and got all that ready. I cleaned out our closet again, which I feel like every month I need to clean that out because it somehow gets piles of stuff in it as the month goes on. I baked these really cool oatmeal muffin things. It's pretty much like muffin in, I don't know, or no, not muffin. It's like oatmeal in just like a little shape of a muffin because super healthy. It had like applesauce, bananas, honey, oats, chia seeds or flax seeds. I think the recipe called for it. I said chia seeds on hand. What else am I missing? Milk. So I mean, it's super. There's no added sugar other than obviously the honey and the banana and applesauce. Anyways, I made those and I've been eating those every morning, and this was a really quick and easy breakfast. So it's just really fun to have a weekend and be able to catch up on all that. And then this weekend, everyone's gone, so it's just me here all by myself, and I am already enjoying it. It's kind of boring, but I'll get a lot of cleaning done and definitely catch up on all my reading and stuff. And I'm kind of energized now with this palliative care and how neuro can help me in primary care, so I have some ideas stuff I want to work on individually. Yeah. that is about it. Anything else that's happening? Not that I can think of. So, halfway done with neurology. Weeks 1 and 2 are done. Weeks 3 and 4 to go. I'm gonna ask my physician if she can give me kind of a midterm report on Monday or Tuesday. I'm not getting very much feedback from her. I don't know. I can't tell if I'm doing well or not well. I don't think I'm doing bad, but I also don't think I'm doing super. So I have like my first compliment from her, which was kind of our first like positive feedback, I guess. Because I don't know, I'm noticing some physicians are very open with their feedback, and every time I leave, they're like, "Oh, really good job! I really liked how you did this today, and this. Maybe work on this." And others are just like, "Okay, well, we'll just see you tomorrow." And I leave like, "Okay, I just keep doing what I'm doing, I guess." So I'm excited to hear maybe what she has to say. But anyways, the positive feedback, a patient was saying something about medical students and stuff, and she's like, "Oh yeah, we've got a good one here, even though she's from a different state, I think she's a keeper or something." So that was the only little positive feedback I got. But I don't know, we'll see. So hope everyone's doing well and has a great weekend. I'll see you guys later.